It impacts tens of thousands of Americans each year. Lymphedema can be a lifelong condition that has no cure. But don't lose hope. There are many treatment options out there. We'll dive into those treatment methods with the doctor of physical therapy coming up on Being Well.
For over 50 years, Horizon Health has been keeping you and your family healthy. And although some things have changed, Horizon Health's commitment to meet the ever-changing needs of our community has remained the same. Horizon Health, 50 years strong.
They're the ones who raise the bar. The ones dedicated to providing care in the most demanding of circumstances. The ones that understand the healing benefits of kindness and compassion. They're the people of Sarah Bush Lincoln, and they set the bar high. Sarah Bush Lincoln, trusted, compassionate care right here close to home.
Carl is redefining healthcare around you, innovating new solutions and offering all levels of care when and where you need it. Investing in technology and research to optimize healthcare, Carl, with Health Alliance, is always at the forefront to help you thrive.
Thank you so much for joining us today for Being Well. I'm your host, Lacey Spence, and today we are talking about lymphedema therapy. Now we've got two wonderful guests with us. We have Morgan Kincaid, Doctor of Physical Therapy, and then we also have Andrea Alexander, and you are a physical therapy assistant, correct?
Correct.
Both from Horizon Health. Thanks for making the trip from Paris.
Thank you for having us.
And so as we're starting off today, first question, what is lymphedema?
So lymphedema is swelling in the limbs. It can be also in the abdomen or in the chest, other areas, but most commonly we're seeing lymphedema is swelling in the limbs. And there's a couple different kinds of lymphedema. Okay. So there's primary lymphedema and there's secondary lymphedema. Primary lymphedema is typically you're born with it. It could be what we call congenital, where you are born with it. There's been damage to the lymphatic system, and a lot of times it actually comes on during puberty.
Oh.
So sometimes it doesn't show until later on in life in the adolescent stage. And then there's secondary lymphedema, which is what we're seeing most commonly. So secondary lymphedema is secondary to something. So there's been damage to the lymphatic system, lymph nodes have been removed for some reason, and then as a result of that, then swelling occurs. The easiest way to explain it is when a woman's had breast cancer and she's had lymph nodes removed, whether that's from a mastectomy, where she's had breast tissue removed, and when those lymph nodes are removed, then they don't function because they're not there.
Sure.
And so as a result of that, then that woman would see swelling in the arm.
Gotcha. And so is it just folks with breast cancer, or who maybe all types of cancer?
Other types of cancer as well. And so in the upper extremity, it's easier to explain where where that defect of the lymphatic system is, versus in the lower extremities, there's more areas that could be from. So in the lower extremity, it may be from a knee replacement, it may be from a hip replacement, it may be because they've had a hysterectomy. So if we looked at a diagram of the lymphatic system, we aren't as familiar with the lymphatic system as we are our arteries and veins. So everyone's heard of arteries and veins. Our arteries take our blood to the tissues and to help nourish the tissues, and our veins bring that blood back up to the heart. The lymphatic system is what kind of is the cleanup crew. So it comes up and there's all our lymphatic vessels on our diagram is going to show in green. And so those lymphatic vessels are found throughout our body. In certain areas of our body, there are lymph nodes, which are the collecting areas, so the collecting ducts. And so the lymphatic vessels feed to those lymph nodes, which we've all heard of lymph nodes, like when you go to the doctor, they check your neck.
If you're swollen
in your lymph nodes, but they're actually throughout our body. So we see groups of them in the axillary region, which is the armpit, behind the knee, in the groin, and then the neck has a lot, and all along your midline, so through your sternum and then through your abdomen. So any abdominal surgery could cause lymphedema in the lower extremities. Any hip surgery it's not as common, but sometimes it does happen with orthopedic surgeries that there could be an issue in the hip area, and it doesn't always have to be surgery. So a woman who's had even a needle biopsy could have lymphedema as a result. It seems like there's no rhyme or reason to it. So you could have a woman who had a radical mastectomy, had all the breast tissue removed. It's a pretty serious surgery, and she may not present with lymphedema, but someone who's had just a simple needle biopsy, that needle, if it happens to go in the wrong area, it could affect the lymphatic system. And it could be from surgery, but it could also be damage to the lymphatic system from for instance, like radiation or chemo or something along those lines. The reason that is because the lymphatic system is very superficial. It's directly underneath the skin. When we do our massage techniques for lymphedema, it's actually just enough to tug the skin. And so that shows, if I'm tugging the skin, I'm stimulating the lymphatic system, versus if I'm massaging, I'm going down to like the deep muscle tissue. So that lymphatic system is very close to the top of the skin. And so it's also very easily damaged. And then as a result, we get swelling.
Gotcha. And so then what are some other risks associated with lymphedema?
So with lymphedema, normally what we see, let's take the legs for an example. If we're looking at swelling in the legs, what often happens is that that leg starts to get firm and fibrotic. It gets hard. We start to see skin changes, which usually is almost like too much skin. It's called hyperplasia. It's almost like there's too much skin. The skin can become almost like wart-like because it's very hard, and it looks tougher than a normal skin would look like. Sometimes we see what's called lymphorrhea, which is weeping or just a drainage from the legs, which is usually a clear drainage. It's usually, I say, oh, it looks like you've sprung a leak, is what I usually say, because they have it's just a little drop, and then it's a clear drainage that happens. And then the real risk is that you could get something called cellulitis, which is a skin infection where the leg becomes red and hot. And then also wounds can form if it continues to increase over time. So normally lymphedema is going to present, sometimes it presents all of a sudden, but most of the time it builds up over time, which can also be dangerous because people don't realize it. Or they'll say, well, my legs have always been heavy. Well, a lot of times it's that they have actually what's called lymphedema or edema for other reasons, but it can become potentially more serious when it turns into cellulitis or wound formation.
And definitely a quick look online and you will see varying levels of lymphedema.
Yes.
And once it gets out of control, I mean, it just looks so painful.
Well, and it's funny you bring that up because lymphedema actually should not be painful.
Oh,
so
wow.
It's more heaviness is the complaint that patients have. And so, yes, they're going to have, maybe if they're swelling around a joint, they may have joint pain there. But the lymphedema throughout the leg, the swelling throughout the leg should not be painful. It's more, it feels really heavy. Or they'll complain that their clothes don't fit right, or something more along those lines. It's not. It looks very painful, but surprisingly, it should not be. Lymphedema in general should not be painful.
This might be a dumb question, but when you say that it feels heavy, is it literally more heavy? As if I'm someone going up the stairs, I would notice that it might be more difficult?
Yes, definitely.
Very much so.
So we see patients lose a lot of weight when they're, when we're seeing them, because you're getting rid of fluid. You're also getting rid of that weight. I think we've had one patient that lost 26 pounds worth of fluid, and these are our more involved patients, but we've had several patients that lose a significant amount of weight from having the lymphedema treatments.
That's crazy. And Andrea, we didn't forget about you down there.
Oh, you're perfectly fine.
Treatment for this, what does that look like, especially in like the beginning stages?
It's a matter of a lot of education. As Morgan has said throughout, that is something that's almost every single treatment I am going through the education of this patient, because it is a lifelong diagnosis. It's not a simple, we'll treat this once and it's going to be done.
You take a pill and you're done.
Exactly. If only it could be that easy. It's treatable. It's not curable. That is one of the hardest things for us to even tell somebody, because it's something that we have to educate them constantly to know that, you're going to be with us for a little while, but this is something that you're going to have to take care of lifelong. So it's something to learn and educate not just yourself, but even family members on what you have to do throughout this time period. When it comes to just the basics of an everyday treatment that will come in is, I'll start with manual lymphatic drainage, which is what Morgan said. It's just a light massage. So we have a certain technique that we do, and it's a certain pattern. And as we're going through them, I'm also educating the patient on something to do that they'll learn later on as well. So on the certain patterns and the types and those specific directions that we have to do for the massage. From there, we do compression wraps. So it's a multi-layered compression that we do. And so one of the biggest educations is you have to be patient with us, because it is a big change for them to be compressed and to have that area that's already heavy and already swollen to have these multi-layers of wrapping that's going to go on. So their activities of daily living is going to change just having us doing these treatments, because if it is an arm, maybe they're not going to be able to bend their elbow as well, or if it's a leg, they're not going to be able to walk nearly as comfortable. Sometimes we can't even put a shoe on. So these are things that they have to be aware of with coming into this. So from the wrapping and just the education that has to go in, it's a lifelong process. Once we actually can have those, we get them down to what we consider a normal level, or what they're going to be able to function with, we get them into custom garments, so that way they can go in and they can wear those during the day, and then they can do their own wrapping at home and massage at home at nighttime to decrease their swelling. So it's a matter of getting them to learn every day is going to be waking up, taking off their wraps if that's what they're able to do, putting on a garment throughout the day, rechecking their skin, making sure that there's no problems in their skin integrity, and then going throughout their day, taking a shower, taking that all off, and then we say 23 out of 24 hours you should be compressed, because even that little bit of time that you don't have that compression, that swelling starts to increase. So we always want to make sure that they understand that little bit of time, even though tomorrow I think I'm really doing really well, that little bit of time
You're tempted, but don't do it.
You wouldn't believe the number of people we have coming back, because they're like, oh, well, I was doing so well, but then I took a day off here and 2 days off here. And then next thing you know, a week's time, and they're already back to where we had them beforehand.
It sounds similar to a diet, like you're trying to take like a cheat day or a cheat couple of hours, and that's not
it doesn't
the way
work.
to do it.
That's very much it.
And so basically it goes from daily, is it daily that they have to come see you to learn about wrapping?
So depending on how involved they are, we can have somebody that comes in twice a week, 3 times a week, and the more excessive, it could be up to 5 days a week.
Wow. And so as they're getting fitted for this garment, is that an intensive process? How does that work?
No, actually, it's actually pretty easy. Morgan, as she does her evaluation, she takes general measurements at the very beginning. And then we take those measurements throughout our course of practice. And then at the very end, once they get within a certain range, we actually take those measurements and we're able to fit them into a garment that best works for them.
And then are those expensive? Does it kind of depend on insurance?
That's a really hard question. Insurance does matter. There are some insurance that do not cover that, which really is hard for some of our patients, because it's a long process. They have therapy that they have to go through, and then they're asked to pay for this item out of pocket. So it is something that we as therapists have to look into, because it is hard for them. I mean, it could be 80 to 100 to, it depends on which limb or area that we're treating on how much these could actually cost.
And so then if that isn't an option, that's where folks are learning like the massage techniques and the wrapping themselves.
Correct.
Gotcha.
There are other things as well that massage is something that's very simple that they can do, but there are compression pumps out there that we've been using a lot lately that helps them to be able to do that massage that maybe they can't move their arms or they can't get to that region and do that massage themselves. So we do have pumps that we have been working with a lot that helps them to do that, and it's much easier on them to get these on.
And when in doubt, how important is it to have like that family support system to be able to assist you if you say you can't reach down to the bottom of your leg or what have you?
It's a lot of, halfway through most of the time our sessions we always ask, or even at the very beginning we always ask how much family support we have, because we're constantly treating them or teaching them what they're supposed to do. And, you know, sometimes it's the easy, hey, mom or dad or husband, wife, can you help me? Or do you notice a difference here? Or if, hey, I really can't reach down there, can you wrap my leg today? Or, I mean, it's something I notice a lot better results, of course, when you do have that support system there, because they're always there to constantly watch you and help you out if you're having a bad day that you're swelling a lot. So it's a really important level to have that support.
And so as you're moving forward into this, does it have to just be one limb? Do the limbs partner? You know, I mean, is it both arms always or both legs? How does that work?
So it depends on the surgery that they have had or the reason that they have lymphedema. We're frequently seeing in the lower extremity that sometimes it is both lower extremities. True lymphedema is usually unilateral, where we will only see it on one side, or one side will be more involved than the other side. But lymphedema therapy is actually also an effective therapy for other diagnoses as well. So chronic venous insufficiency is one that we treat. You know, if the veins aren't working properly, they're not returning that fluid back up to the heart. And so it would follow the same treatment guidelines that we would for lymphedema therapy, because their veins aren't working, there's excess fluid kind of that are pooling in the legs. And so the compression that we do with our manual lymphatic drainage and our compression wraps, compression pumps, compression garment needs are all the same. And so when we see it in both lower extremities or in two limbs, it usually means maybe something else is going on, or maybe it's not true lymphedema. And I usually tell my patients, you know, either way the treatment's the same. So we don't really have to focus on what diagnosis you're receiving. It's more, how do we treat this and how do we continue to treat this? And as Andrea mentioned, just compliance, patient compliance is so important with our treatment. But at the same point, our treatments are very effective. And so patients, we can get their buy-in pretty quickly because it's a lot of work.
Yeah.
So, you know, you've heard just even a snippet of the education that we give to our patients, and it's 23 of 24 hours, you know, all those things that Andrea mentioned. You need to, you know, have some sort of compression all but 1 hour of the day. Yeah. And so it takes a lot of compliance, but we see results very quickly. It's very rewarding for us to be in this field because normally we're seeing good results within a few visits. And so normally the patients see that too, and they say, oh, I have an ankle. I haven't had an ankle in years. I have a bone there. Or, you know, they get excited about it, which is exciting for us too. Yeah. And so we normally get their buy-in because they see what a difference it makes. Or, you know, we talked about the heaviness of the limb. They can walk better. They can do their activities of daily living better because they are more functional, because they can move better.
And so quality of life, while you might have to worry about that wrap, it's still a huge improvement to not have to deal with the heaviness and the swelling.
Absolutely, yes.
And so for our families out there watching, if they've not been diagnosed yet with lymphedema, what should they be on the lookout for?
So swelling in any of the limbs. Normally we have a lot of our oncologists in the area are very good to be proactive. And so for those women who've had breast cancer, a lot of times their oncologist is already giving them a little bit of education, or they may send that patient to us just for a one-time visit to educate them of what to look for. So we have a handout that we normally give our patients, and when we're looking at, for instance, a patient who's had breast cancer or had treatments for breast cancer, maybe they've had mastectomy, maybe they've had radiation, we give them the problem areas to look at. So the top of the hand, look at the top of the hand and see if there's puffiness or swelling in the top of the hand. We usually have them look in the mirror, palms up, look on the medial side, the inside of their forearm, and then we have them bend their elbows up, and we want them to look in this area again in that position.
For the swelling?
For swelling, and look for symmetry between the two sides. Does one look worse than the other? Especially if they've had just a treatment on one side of their body. Right. So that's when we're really looking for symmetry. And Andrea talked about the baseline measurements that we take that first day. So if that's someone where we are seeing them just for a prevention, and we're giving the education of everything to look for, make sure your arm stays soft. You know, our arm should be soft. It shouldn't be hard and fibrotic. Sometimes there's some changes there. Make sure it's not red or hot. But we also take those measurements. And so for a lot of our patients, we may say, okay, I want to see you, you're a new surgery, I want to see you again in a month or in 2 months so that we can remeasure, because we know that this is your baseline and this is where you should be. So if we start to see increases, even if they're gradual, let's be on the lookout. And unfortunately, we always have to be the bearer of bad news.
Yeah.
Lymphedema can come on at any time in your life. It's almost like a scale. And so anytime that scale starts to tip, so anytime there's a fluid overload for your body, there's that scale starts to tip. And so my example I always use is we had a patient who she had had breast cancer. She'd had a mastectomy with lymph nodes removed, but she'd never had any issues with lymphedema. She had a surgery on her leg 9 years later, and lymphedema developed in her upper extremity. Nothing to do with the leg surgery, but it was just enough fluid her body couldn't keep up. And so that overload of fluid tipped the scale enough that she developed lymphedema. And then, once you learn, it sounds scary, but once you learn how to treat it and manage it, and that's the goal, that's the end goal of our therapy, is to teach the patient how to manage their own swelling. And so once you learn how to do that, then maybe it's not so scary.
And when you say that there's no cure, is there a reason for that? Your body just can't re-regulate how it pushes the fluids, or?
So when we look at the diagram again, so if we look at the diagram again, there are what are called watershed areas. And so our body is divided into quadrants. And so, say there's a quadrant that goes here, a quadrant that goes here. Quadrant means 4, so there's more than quadrants, but sections. Sure. And so all the lymphatic vessels feed into that area, into that watershed area. Sure. And what a watershed means is that our vessels are like this. And so our vessels do not cross that line. So if my lymphatic vessels, those green lines that we see, if they cross that line, then this quadrant, say we're talking about this quadrant here, this quadrant could make up for the defect in the quadrant below, for example. But since those vessels do not cross that line, it can't make up for the other. It can't make up for the defect in the other.
So they're
quadrant.
not talking to each other.
They're not talking to each other.
Gotcha.
You've got me now. Okay. So because of that, our body basically can't compensate for it.
Gotcha.
There are surgeries out there, but they're still pretty new. A lot of the research is actually over in Germany or other areas.
That's going to be my next question. So there is a developing kind of future in this, though. Yeah,
there are some, and Andrea could speak more to this because she's gone to a course recently, different surgeries that are available.
There's like nodal transplants and things like that they have been working on, especially with our breast cancer patients, because it is something that happens with lymphedema, because if they're taking, if not half of all, they know that that's going to be a good possibility. So what they're trying to do is trying to go through with those lymph nodes and decide, okay, how many of those are coming out, and maybe we can take one of those good ones and place it into an area that could be highly involved. And if it's the palm or even at the wrist that they notice more swelling, they can then add in a lymph node from a different non-affected area and place it there to see if that will help that uptake and get it back and working. Now, the course that I went to, they have had several successful patients with that. They still have some swelling, and some of the women that's done it do wear a garment on occasion, but they can go maybe a week or so, and then they'll put the garment on for a few days, and then they'll be able to take it off. So it doesn't get rid of it completely, but it is something that you don't have to wear a garment all the time. So there are some things that are at least happening, and hopefully in the future there'll be more that comes out as people are educated, of course, more doctors find out that there are new improvements into medicine. So,
and any surgery also presents a risk. So any additional surgery you're putting in that area presents a risk. And if a woman's had, a lot of times we'll see damage from, it may be from the radiation, and that, for lack of better words, like that area is just completely fried, or it's just there's no the tissue's not pliable. There's not a lot of movement even in the skin, and so we know what we see on the on the outside, so we know that there's additional damage inside, and so any surgery or other treatments could also put them at additional risk is the problem that we see with some of these surgeries. But yeah, we're hopeful it continues to develop. I've been a physical therapist for 10 years, and even in that time, I'm very pleased with the progress that just the education on lymphedema. Now, it used to be we would see patients in the clinic, and because that's our specialty, we would say, oh, that patient has lymphedema. Let's talk to them after they're done with their course of therapy. Let's talk about how we can basically change their lives. They have all this swelling we know that they're dealing with. But now, most primary doctors are recognizing that, or they're catching it earlier on. I feel like there's a lot more education in general throughout the medical field that we are recognizing it sooner, and so then we can also treat it sooner. And the sooner we can treat it, the better off we are.
And the better off we are, smiles hopefully for all of your patients. And that was a quick conversation, a lot of great information, but that's all the time we've got. So thank you so much for joining us today for Being Well, and we will see you next time.
Carl is redefining healthcare around you, innovating new solutions and offering all levels of care when and where you need it. Investing in technology and research to optimize healthcare, Carl, with Health Alliance, is always at the forefront to help you thrive.
They're the ones who raise the bar. The ones dedicated to providing care in the most demanding of circumstances. The ones that understand the healing benefits of kindness and compassion. They're the people of Sarah Bush Lincoln, and they set the bar high. Sarah Bush Lincoln, trusted, compassionate care right here close to home.
For over 50 years, Horizon Health has been keeping you and your family healthy. And although some things have changed, Horizon Health's commitment to meet the ever-changing needs of our community has remained the same. Horizon Health, 50 years strong.